Hello, and welcome to this Cardiff University webinar. This is the latest in our series of webinars under the title of Informing Policy, where the university will be providing a space for Cardiff University academics to speak directly with policymakers on a variety of topics where their research can help inform policy development. Today's webinar looks at poverty and social exclusion. In this session, chaired by Professor Sally Holland, the former Children's Commissioner for Wales, Amanda Hill-Dixon from the Wales Centre for Public Policy and Ellie Harwood from the Child Poverty Action Group look at poverty and social exclusion. Around 25% of Wales' population have been living in poverty for the last 20 years, but we don't know yet how the cost of living crisis is translating into poverty rates. Their research aims to cut through stagnation and deterioration by outlining a way forward for Wales, with implications for the UK more broadly.
Bore da I chi gyd. Good morning, everyone, and welcome to this Cardiff University webinar. This is the latest in our series of webinars under the title Informing Policy, and that's where the university is providing space for Cardiff University academics to speak directly with policymakers. So it's an intentionally elite and small audience, so we can have a good discussion. Today's webinar looks at poverty and social exclusion, such an important topic for us here in Wales. And in this session, Amanda Hill-Dixon, who's a Senior Research Fellow from the Wales Centre for Public Policy, will be looking at poverty and social exclusion. As I think everyone here will know, around 25% of the Welsh population have been living in poverty for the last 20 years. And we don't yet know how the cost of living crisis is translating into poverty rates. So Amanda and our colleague Dan, who's here as well, research aims to cut through stagnation and deterioration by outlining a way forward for poverty in Wales, with implications for the UK more broadly. And I'm absolutely delighted that we're also being joined today by Ellie Harwood, who's Wales Development Manager at the Child Poverty Action Group, who's going to give a response really to the analysis from Amanda and Dan. So this session is going to outline key insights from international evidence, quantitative analysis and lived experience evidence about, firstly, what works to address poverty and social exclusion across 12 key areas, and secondly, how an overarching strategy can best be designed and implemented to coordinate and align efforts to affect real change. So this work has come out of a 2-year collaboration between leading poverty experts, including the Centre of Analysis for Social Exclusion at LSE, the New Policy Institute, the Bevan Foundation, and the Wales Centre for Public Policy. So after we've heard from our speakers, which will be just under half an hour, we will come to questions from you. If you have questions and comments during the session, feel free to pop them in the Q&A function on Zoom, and we'll try to cover them, as many of them as we can in the 10 to 15 minutes after the session. So I'm going to go straight over now to Amanda, who's going to give us a presentation to be followed by Ellie. Welcome, Amanda. Croeso I chi.
Thank you, Sally. If it's okay, it probably actually makes sense for Ellie to present first, and then for me to, and then Ellie, as we've discussed, is very welcome to give kind of responses after that. Is that okay?
That's absolutely great. Okay, go for it, Ellie.
Okay, so I will just share my slides now. Okay, so for those of you I haven't met before, my name's Ellie Harwood. I work for the Child Poverty Action Group, and for the past 2 years, I've also been co-chair of the Wales Antipoverty Coalition, which is a sort of voluntary, unfunded collective of civil society organisations and individuals dedicated to ending poverty in Wales. So part of my role involves working with data to do with poverty, and particularly child poverty in Wales. I have a particular interest in social security and the role that that has in solving poverty, but I also do a lot of qualitative research directly with children and families who are living in poverty. And I've spent much of the past 3 years, including all through the COVID pandemic, carrying out research, action research normally, with school communities across Wales, trying to understand what life has been like for them through COVID and now the cost of living crisis, I mean, we can kind of come back and reflect perhaps on some of the things we learned, but what I'm going to do now really is just set out some of the very sort of high level statistics. And I think one thing that we probably will discuss today, and I know Amanda can say a lot more about this, is that the definitions of poverty that I'll be talking about are to do with relative income poverty. So these are the official statistics that are used by the UK government and the Welsh government, and they tend to be the ones that most of our targets, milestones or indicators are based on. This is one dimension of poverty. It's to do with relative income inequality. And I think one of the really interesting and useful things in the work that's been carried out by the Welsh Centre for Public Policy in this area is moving towards perhaps a more multi-dimensional measure of poverty that incorporates access to resources, human rights, access to goods and services. So kind of, looking beyond income alone. However, it's worth saying that, the general way that we talk about poverty and that poverty is understood, that it's spoken about in the media, and when people quote statistics in Senate debates and so on, they're talking about relative income poverty. And there are actually really good reasons why this is a very important measure, and certainly not anything that we would recommend moving away from, because it allows us to look at how poverty is changing over time. It allows us to compare, the changes in the composition of the different groups in poverty. It allows us to measure the persistence of poverty, and it allows us to compare ourselves to other UK nations and internationally, because it's a standardized measure. So for all these reasons, using a measure of relative income poverty is quite helpful. However, we have reached a really difficult point, I think, in Wales as a community of people who want to use relative income poverty as a way of capturing how many people and who are in poverty. And that's because there's been a serious disruption to the survey that is used to collect the data and model the rates of poverty in the Welsh population. Basically, not enough people in Wales are involved in the survey that underpins the households below average income data set that we then use to produce most poverty statistics. And this means that we don't have statistically reliable official data on poverty rates in Wales now, up to the pandemic and beyond. However, we have attempted to look at child poverty by drawing on other available data sets around tax and benefit records and so on. But it is really hard. But I think when we look back, it's always helpful to consider the long-term trend. And we've always had to do this with Welsh relative income poverty data anyway. You have to use a 3-year rolling average, because the sample sizes have always been inadequate. And they are very inadequate in terms of looking at the way that poverty affects particular groups in the population. So we've never been able to get reliable figures on, for example, the proportion of Black, Asian and minority ethnic children in poverty. So, what we can see looking at this data is that poverty rates do fluctuate in Wales, but they are broadly consistent over time. We will expect to see, probably in the previous financial year that's just gone, that poverty probably has got worse for most groups due to a cut in social security, and that tends to be the real thing that drives rising and falling income poverty rates. However, there's a great deal of uncertainty, which I'll talk about when we come to the forecasting kind of section. But I think we feel fairly confident in saying that around 1 in 3 Welsh children are living below the poverty line at the moment, and this is based on tax and benefit data, and then a combination of other sources, and those data are published by the End Child Poverty Coalition that we're part of. I think the other thing to sort of obviously say when we're talking about poverty rates is that they vary hugely between households with different characteristics. And I know this won't be a surprise, particularly, Sally, I know that you've paid keen interest in poverty rates for children in larger families and the impact of the 2-child limit. What we do know is that even if, for example, the rate of child poverty stays relatively consistent over time, perhaps moving by sort of 1 or 2%, when you start breaking that down into household type, looking at the number of children, we can see that the rates are growing really fast in larger families and actually declining in smaller families. So one of the things, you know, when we're talking to perhaps public bodies or local authorities about designing kind of action plans around poverty or child poverty particularly, is to really start thinking a little bit more about the kind of intersectional nature of poverty and the way that particularly household composition, household size can affect poverty rates. It's really difficult to forecast where poverty rates are going to go at the moment because we're in an extremely volatile economic context, and you know, the sort of leading economists in the UK are having real difficulty predicting if we'll be in recession from one quarter to the next, unemployment and so on. And even, you know, obviously government fiscal policy as well, including social security policy, it's really, really difficult to know what they're planning to do next. What kind of cuts are going to be made, or, you know, for us, whether benefits are going to be raised in line with the cost of living, because these things have a huge impact, and it's very, very difficult because we don't even know who's going to be the Prime Minister, you know, often, or what kind of social policy they're going to carry out. So it's a bit of a kind of, you know, futile task, really looking too far ahead. However, some people do attempt that, and actually I think, you know, something that's sort of really struck me in the Resolution Foundation's work, looking into kind of the likely future trends around poverty, is that actually we won't see huge changes, or maybe even see reductions in the very headline poverty rates. So it might be that, you know, when it comes around to talking about households below average income data this year or next year, that actually poverty goes down, which is counterintuitive to what most people think, and a lot of what the discourse around it is, that actually poverty's been getting much worse through the pandemic, and is continuing because of the cost of living crisis and the conflation of the two issues. But actually, if median incomes fall and social security rises in line with the cost of living, then actually that we might see a reduction. And this is, you know, the kind of thing that's very difficult to communicate to policymakers, and you know, and to the public as well. But one group that almost certainly will see very large rises in their risk of poverty are children in larger families. And that's because there's been no commitment to removing a policy called the 2-child limit, which restricts the amount of social security that's available on means tested benefits to families with children. So if a family has 2 children and then they have any subsequent children after April 2017, they are not entitled to any additional support for the costs of raising those children outside of a limited number of benefits. And this is the policy that is driving these huge rises, you know, and you can see on the slide that we're looking, unfortunately, at some extraordinarily high numbers. Basically, it'll be very difficult for any family with you know 4 or more children to avoid poverty in a few years' time. I mean, the other thing I think that I try and bring up a lot when I talk about poverty in Wales and I talk about the solutions to it is that there's a kind of an understanding that people are trapped in poverty and that it's the same group of people over time. But actually, poverty in Wales is quite dynamic, as it is in the whole of the UK, actually. We have quite a large share of entries and exits into relative income poverty from year to year. So for many people, poverty is a transient experience, and we estimate that around half of children in poverty will spend, half of children in Wales will spend some period of their childhood in poverty. Now, any spell in poverty, whether it's a year or more, is harmful to children. It prevents them from developing to their fullest potential and causes unimaginable stress for their parents and carers and the children themselves. And you can track this using longitudinal studies, looking at the kind of academic outcomes and the other sort of measures, you know, like labour force participation and so on, help, you know, across the life course. However, you know, we do actually have higher levels of persistent poverty for some groups than we would see, particularly in other devolved nations. And I think this is where I like to make these comparisons, because if you look at the rates in Scotland, particularly, that's an example of the kind of things that devolved governments can do to make a difference in particularly around policies that support children and reduce child poverty. But, you know, we we have fewer children in persistent poverty than England. We have more working age adults in persistent poverty than elsewhere in the UK. Our pensioners are less likely to be in persistent poverty, and overall the rate is basically consistent with the UK average, which is mostly driven by England having the by far the largest share of the population. But I think, often when I talk to people who want to kind of do anti-poverty policy, they often assume that they can really easily identify who's in poverty. And this particularly comes with schools, where they say, we know our families, we know the ones that are in poverty. And of course, that to me is the sort of warning that actually they probably don't really understand that, poverty is dynamic, and that you can't tell by looking at someone. It's not social class. It's not to do with people's prior educational attainment or how they speak or present or where they live. It's actually to do with how much money is coming into their household. And this makes it much more difficult for people to predict, but it also gives us hope, because we know the events and the actions that prevent people from entering poverty and the things that help them exit poverty as well. So whilst persistent poverty is extremely harmful, and these figures are disgusting, to be honest, this shouldn't be something that we tolerate at all. It does mean that we need to perhaps have a much more nuanced approach, I think, to addressing what the challenges facing people who are perhaps new to poverty, and helping those exit, and then those who experience poverty over the longer term.
Ellie, can I ask you to start wrapping up, please?
Of course, I'm on the left side, yeah.
Brilliant.
So, a final point is, obviously I've talked a lot about relative income poverty, and we've had a point resistance, I think, from the government in terms of producing an all Wales anti-poverty strategy. And part of that has been that we can't produce reliable targets because the data is not always available to do that, or that it can be difficult. But we use a really wide range of different sources to kind of get a picture all the time, a snapshot. And I would just sort of urge making use of all the amazing civil society organisations that some of whom are in the Anti-Poverty Coalition, but others who work at a UK level, who are producing contemporary indicators of how poverty, material deprivation, social exclusion, and so on is affecting people. And the point being that we shouldn't let a lack of official statistics prevent us from setting ambitious targets and robust indicators across many more domains than we currently do. And then the final point, is a quote that I use a lot from Baroness Lister, who, has written extensively on poverty, and she does so much work in Parliament to progress the cause of children in poverty, particularly. And that is that, although I've spoken a lot about relative income poverty, we cannot ever forget that it's not just a disadvantaged and insecure economic condition, but it is also a shameful and corrosive social relation. And that is why, I'm really passionate about using mixed methods research, participatory research, and, qualitative understanding of poverty, including the kind of lived experience work, in order to get that really kind of robust picture, and also to hold the government to account and help us understand what programmes work and what's helping and what isn't. So
thank you so much, Ellie. That's been such a fantastic introduction, and very powerful reminder of where we're at. Right, I'm going to go straight over to Amanda.
Thank you, Sally, and thanks so much, Ellie, for setting the scene so eloquently. So I'm going to be talking more about how we can kind of address this situation that Ellie outlined. For those of you who don't know about the Welsh Centre for Public Policy, we're an independent research centre based at Cardiff University, and we exist to support decision makers in Wales to access, understand, and use the best available evidence for the challenges they're dealing with. So the Poverty Review, which we published in September last year, consisted of kind of a whole suite of reports based on multiple methods. So just to give you a kind of quick sense of what that included, there was a sort of analysis of the state and nature of poverty and social exclusion in Wales, largely quantitative. We reviewed existing and collected new lived experience evidence. There was an international review of anti-poverty strategies and an international review of anti-poverty policies and programmes. And that was created and kind of delivered in partnership with LSE, Bevan Foundation, and New Policy Institute, amongst others. So all of those reports are available on our website for anybody who's interested. So while the focus at the moment is kind of rightly on the short-term acute crisis, we would argue that we need to be thinking about 3 time horizons, which you can see on the screen there. So short, medium and longer term. And really thinking how we can use the kind of short-term crisis and the political and kind of broader momentum that is around that at the moment to lay the groundwork for what needs to be done over the longer term to address poverty in Wales now and in the future. So I'm going to cover kind of 3 main areas. First of all, how we might work together to address poverty through creating a kind of an overarching strategy for poverty. Secondly, what kinds of policies and programs and interventions that might include. And then thirdly, actually echoing what you touched on, Ellie, a new project we're thinking about around poverty stigma. So in terms of the how, we looked at around 8 international anti-poverty strategies and kind of how, in what ways they were effective. And we used that to pull together kind of 5 important considerations for an anti-poverty strategy, which you can see on the screen there. So the first kind of key consideration we'd suggest is prioritization, which any good strategy needs to include. So it will include kind of realistic and achievable actions that meet those aims, and it will provide a framework for coherence and coordination of delivery. And we suggest that investing good time on design and planning and thinking through implementation is crucial. You know, we know that in the current context, this will be making difficult choices based on an honest assessment of the funding capacity and powers available. Secondly, a strategy needs to think about a policy mix, an optimal policy mix. And that's because, as Ellie kind of outlined, poverty is multidimensional. So no single policy is going to be enough, and a strategy therefore needs to identify linked interventions and the means by which these will fit together, both in their design and delivery. Thirdly, we suggest the strategy needs to think carefully about delivery agents. And this is because no one organisation, not even the Welsh Government or Welsh Public Services, can deliver the support needed. A strategy needs to identify what needs to be done by whom and how organisations are supported and challenged to play that role. Fourth, we emphasise the importance of monitoring, so how we will know whether the desired impact of the policies and interventions is being achieved. And our international review found that sort of measuring outputs or counting the number of people reached, it does matter, but too little is known about the actual outcomes and effectiveness of existing programmes or services. So we'd really argue that a monitoring and evaluation strategy needs to get to outcomes as well as outputs. And fifth, and crucially, the whole approach really needs to think about and kind of involve participation. So that's ethical, authentic and meaningful participation, or some would argue leadership by experts by experience, which can be both a successful approach to service delivery as well as an intervention in itself. So we've seen evidence that suggests that co-production and participation are key ways of ensuring a dignified and respectful approach to addressing poverty, and kind of a way of addressing the poverty stigma that Ellie emphasised at the end there. So there's questions that we think emerge from the reflections on strategy, which we perhaps could lead into the discussion later. So there's 4 questions there. Firstly, as I've sort of hinted already, how can the response to the immediate crisis lay the groundwork for the longer term? Secondly, how can we improve data and data use to inform decision making, including kind of strategy, design and evaluation? Thirdly, how can we involve communities and individuals in understanding need and designing the response to this? And then fourth, what kinds of partnerships are needed and how can we enable them? And behind these questions is an assessment of the context of financial constraint and, in reality, limited options that are facing us at the moment. So we really need to work together to identify small but potentially high impact improvements in the way we work, focusing on building infrastructure for medium to longer term change, and to at least ensure that what we are doing well and effectively. So moving on to kind of the what, so what kinds of policies and interventions are likely to be effective as part of a future anti-poverty strategy for Wales. And we want you to think about these as sort of more than a list or menu, and think about kind of which types of policies are going to work best in combination with each other for kind of mutually reinforcing benefit. So in our recent report, for tackling poverty, we developed one illustration of how prioritisation and identification of a policy mix might be achieved, which we call a prioritising framework, as shown on the slide with those 4 elements. So the first element is about reducing costs and maximising income. So we outline a range of kind of effective ways of maximising an individual or household's available financial resources so that basic needs are consistently met and households do not have to kind of repeatedly battle to make ends meet. And we suggest that this focus on increasing financial resources should be a cornerstone of any anti-poverty strategy. So we acknowledge, and our model reflects the idea that poverty is multidimensional and not just financial and material, but we do argue that the financial and material does need to be at the core of any strategy, and it's really important that doesn't get lost. So we look specifically at international evidence on what works in relation to take-up of cash transfers, affordable housing, household debt, food insecurity, and fuel poverty. But it's also thinking slightly longer term in terms of pathways out of poverty. So we looked at evidence-based support to help people address the drivers of poverty over the medium and longer term, for example, through access to further education and skills, higher quality and better paid work, flexible and affordable childcare, and essential infrastructure such as transport, which gets people to the work and learning, which can offer them a pathway out of poverty. And we also suggest that it's important to think about the whole environment that people find themselves in. So we talk about this as an enabling environment, both physical and virtual environment or neighbourhood, which is so important in determining quality of life, socioeconomic and civic participation. And we also considered, as well as kind of the areas you can see on the screen there, so neighbourhood environment, digital exclusion and youth services, housing is also clearly a key part of this, which could fit in reducing costs and maximising income or an enabling environment. So underpinning those kind of 3 key areas, we've recommended that consideration be given to the ways in which anti-poverty policies, programmes and services can and do affect people's mental health and well-being, and in turn their capacity to take positive steps in their lives. So just like Ellie said, the lived experience evidence that we collected repeatedly highlighted the mental load and often stigma that people in poverty experience as a result of seeking support, as well as through other kind of channels. And this is an unnecessary and counterproductive unintended consequence of the current system. So as such, we've recommended that all policies and services need to be formulated, designed and delivered in a way which is respectful, humanising and treats people with dignity. And involving people through meaningful participation is a key way of doing that. For example, through poverty truth commissions, which is a kind of increasingly promising model, as is going on in Swansea at the moment. So that gives you a flavour of, so that's the 12 policy areas that we cover in our report. I'm going to briefly outline some of the findings in relation just to take up of cash transfers, and specifically what the evidence said there. But if you're interested in any of those other 12 areas, then please do look at the report on our website. So take up of cash transfers is about encouraging people to take up the benefits they're entitled to. It's obviously not going to be applicable to everybody in Wales because some people already claim their maximum entitlement, but we know that every year in the UK, around £15 billion goes unclaimed. So there are people in Wales who are entitled to more than they are receiving. The first 2 interventions here on the table cover tackle individual level barriers to take up. So firstly, a very simple idea, but it's not always done as well as it should be, providing people with information about what they're entitled to and how to claim it. And there's strong evidence from the US that clear messaging can increase take up, but those effects can be short term, so repeated messages are important, and the information really needs to be simple and accurate, along with those reminders to increase take up even further. And it's really important as part of that language is carefully crafted to be accessible, supportive and non-stigmatizing, to protect kind of people's mental health and avoid damaging stereotypes. And provision of information can be even more effective when combined with assistance with the claiming process. So that's the second row there. And that has generally positive impacts on take-up, which we know from studies which looked at what happened in the US when Social Security field offices were closed. There was a significant decline in the number of disability benefit recipients in the local area. And there's evidence that it's people of lower socioeconomic status and educational levels who benefit more from that personal assistance with the claiming process. And thirdly, this approach can be kind of strengthened even more when combined with partnership building. So this is about engaging local networks to encourage take-up via known and trusted people and organisations, and to use those relationships to increase take-up. But it's also really important that we don't just look at individual level barriers to take-up. It's also really important that we look at kind of systemic factors which are acting as a barrier to people's take-up. So lastly, you can see automatic enrolment. Sorry, I'm just going to turn on my charger. Sorry about that. My laptop was just about to turn off. So the last kind of intervention there, automatic enrolment, it's about making the social security system easier to access, for example, by automatically enrolling people based on administrative data. And that can also effectively signal an endorsement of take-up by the state, and can kind of relieve claimants from a burden and can relieve stigma. And there's strong evidence that that can be effective. So, Sally, I've got a few more slides, but I just want to check how I'm doing for time.
I think you can have about 4 more minutes.
Okay, cool. So that I've just kind of outlined some of the key findings and a taste of what we published in our poverty review in the autumn last year. But I also just want to tell you a little bit about what next for our work on poverty, and it would be great to get any kind of feedback on this in the discussion. So in our lived experience research, we kind of repeatedly found that people with lived experience of poverty were emphasising to us the mental health and kind of psychological dimensions of poverty that they were experiencing, but that wasn't covered in our international review of anti-poverty policies and programmes. So we kind of really thought this was a gap in our research. So we're doing some scoping on it at the moment, and I'm sure kind of, as many of you will know, there's really strong evidence internationally and from within Wales that poverty and poor mental health interact and reinforce each other. So internationally, those with the lowest incomes are 1.5 to 3 times more likely than the rich to experience depression or anxiety. In Wales, the poorest children are 4 times as likely to have serious mental health difficulties than the wealthiest children. And as you can see with the diagram there, it's not just the kind of association that we know about. There's also empirical evidence on the mechanisms through which poverty and poor mental health interact, which you can see on the diagram there. So, for example, just to pick out a couple, increasing worry and anxiety about how to make ends meet, and the kind of mental load associated with that can clearly lead to kind of poor mental health. And then on the flip side, poor mental health is a key driver of unemployment and underemployment. But 2 of the kind of particular mechanisms that we're interested in at the moment is about shame and stigma, which can be understood as kind of specific mechanisms through which poverty and poor mental health interact. So poverty can be experienced as low social status, which you can see highlighted there, which marks people out as inferior or different, which leads to poor mental health and low self-esteem. And then on the other side, beliefs such as low self-esteem and self-stigma and shame can limit people's aspirations, education and employment, which can lead to poverty. So we did a bit more kind of digging about the relationship between poverty, mental health and stigma. And Ellie, I have to say snap, because we chose the same quote there, which is a really powerful quote. Basically just to say that lots of really kind of leading poverty scholars have really concluded and argue that poverty is not just an economic condition, but it's also about shame and social relations. And similarly, slightly differently, but similarly, kind of Amartya Sen argues that the ability to go about without shame is at the irreducible core in the idea of poverty. So kind of more kind of empirically, there's also evidence to kind of explain these relationships. So poverty stigma is associated with 4 aspects of poor mental health. So negative self-evaluations, poor self-esteem, diminished social well-being, so that could be social isolation, negative affect, shame, stress, embarrassment, and mental ill health, so depression and suicidal thoughts. And then we also wanted to look at kind of what works to address poverty stigma. There's a lot less evidence on this, but we think this is an area that would be increasingly kind of that there's sort of scope for us to do more research here, and these are our tentative findings. So cash transfers are likely to be at least partially effective because they address some of the known drivers of poverty-related stigma. So it'll be really interesting to see the results of Cascade's evaluation of the basic income pilot in relation to that. But obviously kind of cash transfers are of limited feasibility to the Welsh Government. So we wanted to look at alternative and potentially cheaper approaches. So there are sort of promising initiatives based on evidence of initiative which address the causes, the known causes of poverty-related stigma. And we sort of broken these down into what we deliver and how. So this could be about redesigning social security and broader support services to place dignity and respect at their heart, which is what Scotland's trying to do through its new social security system. For example, by reducing compliance demands, training staff in non-judgmental practice, and avoiding processes which differentiate people, which we see time and time again in schools, for example, as Ellie's research highlights. It's also about how we design services, so involving people with lived experience in design, delivery, and evaluation. And then it's also crucially about how we collectively talk about poverty and to tackle damaging narratives which emerge in the media and in political narratives and just in kind of general discourse that all of us use. So there's a couple of really interesting initiatives there, which we want to look more at. And we'd be interested to see any other evidence or initiatives that any of you know about which could tackle poverty stigma. So I've put some suggested questions there, but just generally open to any feedback or questions anybody has on anything Ellie or I have presented.
Thank you very much, Amanda, and Ellie, of course, as well.